Good afternoon, everyone. Welcome to our latest edition of the ReActivating Edmonton webinar series, where today we're going to be focusing on the importance of sport and community for overall well-being during COVID-19. So this is a webinar series that's been hosted by Edmonton Sport Council, focusing on a number of different topics. And this week I'm pleased to welcome two wonderful guests with us. We have Dr. Richard Lewanczuk, and we have Dr. Kate Storey, and I'll read out their bios in a moment to give you a little bit about who they are, and then we'll get to hear from them today. Before I get started, I do want to just sort of mention a couple of things. The first housekeeping item is that we are recording the session, so if you have any discomfort with that or you're not interested, you're welcome to turn your video off. As well, if you could also mute your microphone unless you are speaking. But we do invite questions or comments to put them through the chat box. That's kind of the easiest way for us to kind of pay attention and facilitate, given the size of the group today. Just really briefly about myself, as I said my name, I am a board member with the Edmonton Sport Council, and I'm also the director of the Sedgwick Center over at the University of Alberta. So really committed and interested in hearing from our speakers today so that we can learn more about sport and community and what that means for our overall well-being during this unique time of COVID-19. So to get us started, I'm going to introduce Dr. Richard Lewanczuk. He is the Senior Medical Director of Enhancing Care in the Community at Alberta Health Services. So enhancing care in the community helps and ensures that we can enable people to be as healthy, well, and independent as they can be in their homes and communities. The ECC represents Alberta Health Services' shift from a reactive acute care facility-based healthcare system to one where there is a focus on keeping people healthy and well in the community. Dr. Lewanczuk is incredibly generous with his time and is a great mentor of health and well-being in Alberta. When not working, Dr. Lewanczuk says he loves to be outdoors. He ran his first marathon at 50 and his first ultra marathon at 62. I love this quote here. It says, "You can get fitter as you get older." So I'm really thrilled to have a chance to hear from Richard, and I would like to invite Richard to kind of take over and share his screen, and we can go from here.
Thanks very much. I'll just get my screen shared here, and hopefully you can see it. So I was going to talk a little bit about the impact of COVID on mental health and then the benefit of sport, recreation, and activity in relation to that. We know with COVID, we talk about sort of 4 waves, not the same as we're thinking these days, but the first wave of COVID was the acute effects of COVID, people that had the disease. Second wave was the impact on the healthcare system from people that stayed away who should have been coming to the healthcare system. Third wave was the impact of people coming to the healthcare system after things start to get better, but their chronic conditions may have gotten worse. But what we're going to focus on today is actually the 4th wave, and it's already been found in places like China and Spain that this is very, very significant. We also know from the Fort McMurray fires that it's also significant, and that is the psychic or psychological trauma, the mental challenges that occur as a result of everything that we've been through with COVID. So I was going to ask, how many times have we heard this? But I should change that to how many times today have you heard this? We're all in this together, right? And every TV ad everywhere, we're all in this together, we're all in this together. And I would say nonsense. We were all in this alone, and that was the problem. So the social distancing and the requirements of social distancing, particularly right at the very beginning, and when we're really, really afraid, we were all told to go into our houses, barricade the doors, don't talk to anybody, don't interact with anybody. And of course, what did this do? Well, this led to social isolation, and of course, social isolation leads to loneliness. And so just by way of definition quickly, we know that social isolation is a lack of social relationships and contact, whereas loneliness is the unpleasant feeling that comes from social isolation. Well, the problem is that social isolation, even in the absence of loneliness, is bad for you. And how is it bad for you? Well, right off the bat, if you want to go to the most extreme, it's actually related to mortality. So people or communities that are socially isolated have higher mortality rates. Even in Alberta, we know that loneliness is the single greatest predictor of healthcare utilization or hospitalization amongst our senior population. It's a better predictor or has a stronger influence than does the presence of, say, even 3 chronic diseases. To put it in another aspect, it's been estimated that having weak social connections, being socially isolated and lonely, is the health equivalent of smoking about half a pack of cigarettes per day. So for the last 2.5 months, we've been asking ourselves and our children to smoke half a pack of cigarettes per day. So how often would we have done that? Well, we know that loneliness is actually associated with a number of diseases. It's associated with high blood pressure, diabetes, and depression. These are the 3 commonest and most prevalent chronic conditions in Alberta, Canada, and in fact the world. And all of them are either can be triggered by or worsened by loneliness and social isolation. And there are other things, headache, fatigue, cardiovascular disease, all associated with loneliness. Well, how on earth does loneliness and social isolation lead to disease? Well, it actually turns out that there's biology behind this. And we know that our grand theory of disease these days, cardiovascular disease, cancer, all of that relates to low-level inflammation. And the presence of loneliness and social isolation triggers this low-level inflammation, possibly as a result of the stress response. So this slide just indicates that people who are more socially isolated have a higher degree of this inflammation. Their blood pressures are higher, their weights go up. If they happen to have diabetes, blood sugar levels go up. And in fact, you don't need to know anything about genetics just to interpret this slide. And this slide really looks at the genetic effects of loneliness. So it took 2 sets of people, those who are socially isolated, those who are well integrated, and compared gene expression. And you can see that there are quite a number of genes in our genome that are differentially expressed as a result of social isolation. And a lot of these genes that are expressed are the ones that lead to inflammation and lead to disease. And actually in experimental studies, the real worrisome thing is that a lot of these changes are not reversible, and a lot of these changes occur after only 1 month of social isolation. We've had 2.5 months of social isolation, so we could already have permanent physical effects of that social isolation. But it gets even better or worse depending on your perspective. We know that social isolation and loneliness also affects our immune systems. And so this is just more a slide to remind me to say that. But this is sort of one of the most interesting studies I've run across. And so this study was done in college or university age young adults, young men and women, done in Sweden with 404 of them. They took this group of 404, and for a month they looked at what their stress levels were. Then they divided this group into 2 groups, those who had above average stress and those who had those who had above average social supports and those who had below average social supports. And then they actually exposed them to the cold virus or a cold virus and looked to see how many became infected with a cold. And it turns out that if you had strong social supports, you were actually protected from being infected by a cold. If you had weak social supports, you were at greater risk. And the greater the stress, the greater the risk. So I think you can already look at the parallels with COVID. We've introduced social isolation, loneliness, which is a stress, just the stress and fear of getting COVID. And now we've created social isolation. So in fact, paradoxically, we've increased the chance of people of actually becoming infected. They did another analysis of this study, and they actually looked at hugs. And they looked at people who got above average number of hugs and below average number of hugs. And if you happen to be in the group that got above average of hugs, hugging actually protected you from being infected with the cold virus. That's a whole other talk, the importance of physical contact in COVID and in our relationships. Well, we actually know that physical contact, and even face-to-face human contact has a lot of benefits. So face-to-face contact releases a whole host of beneficial hormones, beneficial neurotransmitters, whereas the opposite, lack of contact, has the opposite effect. We release stress hormones. It has an adverse effect on our brain neurotransmitters that make us more predisposed to anxiety and depression, and releases inflammatory mediators. So there are benefits from human contact. I took this picture actually in Buenos Aires. I should have been taking a picture of the statue of Mendoza behind this fellow, but this fellow caught my attention. As you can see, sort of what we would imagine to be the stereotypical homeless person. And what caught my attention is that this fellow had a piece of bread and he was feeding the pigeons with this bread. And I thought to myself in my self-righteous manner, okay, why are you feeding, you could probably use this bread yourself, so why are you giving it to the pigeons? And then it struck me that for that 5 minutes, those pigeons were providing him friendship. But then I thought a little bit more and I realized for that same 5 minutes, not only were those pigeons his friends, but he actually now had a purpose in life. He had something to do, somebody to depend on him. And I'm sure we're all familiar with, Maslow's hierarchy of needs of, needing physiological things like air, water, food, shelter, safety, and so on. But I would suggest that actually it's not a hierarchy, that all of us at all times need things like a purpose in life, something to do, meaning in our lives to be healthy. And so how often have we seen this? Again, homeless person with an animal. And again, in my self-righteous matter, it's, why do you have an animal? You can't even look after yourself. But again, there's companionship, somebody to look after. And it turns out that having meaning and a purpose in life actually does keep us healthy. It keeps us physically healthy and it keeps us mentally healthy as well. And so let's sort of go back to COVID and where we are today. Well, it turns out that as we're young and we haven't figured out our purpose in life, we're more likely to be searching for meaning. And if you have meaning in life, your mental health will be better. But if you're searching for meaning, your mental health will be worse. So all of a sudden, if you have no chance, no opportunity to participate in meaningful activities, such as if you're socially isolated and lonely, of course, it has that impact on health. Well, it turns out that you only require 3 things to be happy. You need something to do, you need someone to love. Interesting, not someone to love you, but someone for you to love. Think of the fellow with the pigeons or the fellow with the dog, and something to look forward to. Well, what did we do with COVID? Something to do. We took that away. Lock yourself in the house. Let's barricade the playgrounds, barricade the soccer fields. Don't let anybody participate in any sort of sports or activity. Discourage going outside. Something to look forward to. Can't look forward to any sort of activity, sports or equivalent. And then someone to love. Well, that maybe is not quite as affected. Well, it turns out that pre-COVID, we were already in a bit of an epidemic of loneliness, highest loneliness levels we've ever seen before. And believe it or not, it's not a frail older person who's the most lonely. It turns out younger people are the most lonely. And that's shown here. As we get younger, we actually have higher loneliness levels. This is American data, but it also applies to Canada. But how can this be? Of course, young people are always on social media, on their phones, on whatever the appropriate social and trendy social media is of the day, of which I'm totally out of touch with. But it turns out that does not really mitigate our loneliness. We need that face-to-face contact and interaction. Well, now let's throw COVID into the mix and what happens. This is Canadian data, surveys on physical distancing. So this survey question asks, did physical distancing make you feel lonely or isolated? And so for a number of people that strongly agreed or somewhat agreed, that was the majority of our population. And highlighted in the red boxes is, again, the youngest people had the highest degree of loneliness and were affected the most by social isolation. The challenge is we didn't go below age 18. So I wonder what's happening with school-age children. If we look again, what are the prevalence rates and what's the consequences of this? Well, when we're socially isolated, we're affected by the loneliness, we're much less likely to be physically active. It promotes physical inactivity. We don't watch our diets. Bad habits like smoking increase, and they increase the most in the younger group, younger age group. We heard today in the news, other ways of coping, cannabis, alcohol, binge drinking, all go up during things like COVID. So what can we do about it? Well, one of the answers is, what is it that brings us together and gives us social connection, gives us opportunity to deal with the stresses? And so you can see here, we're going to be talking about sort of sport and activity. And I stole this slide from myself because it actually shows athletes touching each other, which, by the way, all athletes, not only are they encouraged, they're required to touch each other. I was informed that actually the University of Alberta Golden Bears and Pandas teams are required to touch, and that there's a person that sits in the crowd counting how many times they touch each other just because of the team building and the physical benefits of touch. Well, it turns out that physical activity, no surprise, actually increases our resilience. I personally don't like the word resilience because I sort of think it means sort of put up and shut up, but our coping skills. Physical activity actually enables us to cope with stress better. It's been shown in both adults and also shown in children. This might be one of Brian's running groups. So it does help us cope with stressful situations. It reminds me as well that physical activity also goes along with being outdoors. So when we're outdoors, it turns out that being outdoors in the green spaces has a health benefit, both physical and mental. And what do we do when we're outdoors? We're quite likely to be physically active. So in fact, there's an interaction with being outdoors and being physically active, all of benefit. But what did we do with COVID? Stay inside, barricade the doors, bar the parks, don't go out to the parks. Well, physical activity, recreation, sports has that mental benefit. It has a mental benefit on relieving stress with COVID or without. It also has social benefits. Remember all of the impacts of social isolation. So when we get together, either as sports teams or participating as individuals in a common sport, we have that benefit of the socialization, which I believe we're going to hear more about in a moment. But there's other benefits as well. It improves our mood when we are physically active or participate in sports and recreation. It helps reduce stress and depression, all of which have been increased with COVID. Improves our sleep habits, which deteriorate with stress, helps us physically as well. It improves self-confidence. But there's some other items on this list that I really want to draw your attention to. What does sport and physical activity do? Well, it does things like it boosts our self-esteem, sense of belonging, and accomplishment. It obviously gives us something to do. What did we say was needed for happiness? Something to do. Sport is a big player in giving us something to do, and particularly in some of the rural areas where there isn't that ability to partake in sports. A lot of school-age children really complain about there's nothing to do, or how many times have our children or people that we know say, I have nothing to do. That sense of belonging to a team or participating in a sport, sense of accomplishment, as you can see yourself getting better and better, has profound effects on improving our mental health and our self-esteem as well. So what are the things that children do if they don't have these opportunities, through things like sport and activity, to get that sense of accomplishment and being? Well, there's other groups that people can join that are perhaps not so socially acceptable. Where do we think gangs come from? So as we talk about, refunding or defunding of police, it's not the police's fault, but they're picking up the pieces after we choose not to invest in preventing people from having to rely on some of these other adverse coping mechanisms. So in fact, the experts tell us they recognize the psychological impact of things like quarantine and its adverse effects, and they tell us, really, we only want to quarantine when it's necessary, and we want to minimize the time that we actually have to do that because of all of the impacts. So one of the great ways in which we can deal with, as I say, with the stresses, help us to cope, help us to recover, is through sport, activity, recreation. It has, of course, the physical benefits, but it has the mental benefits on stress and our emotions, and it also has the social benefits as well. If we don't provide that opportunity, if we don't have their opportunities, well, this is what we can be. This is what we were during COVID. but the alternatives are this as well. So hopefully we can use our learnings from COVID. Maybe it's highlighted the importance of sport, recreation, activity in our lives. And as we come out of COVID, we can further increase our participation and realize the importance and the benefit of sport, not just in the physical and preventing chronic disease, but in the emotional health and community building as well. So I'll finish there.
Richard, thank you so much for sharing your thoughts, and really, I think, coming at the importance of sport and physical activity kind of from a different direction. I think, you know, there's no question that it is important, but it's really helpful, I think, for people to think about the why. And so for those of you that have questions, I want you to kind of hang on to them, or you can start to put them into the chat box. But what I'm going to do is introduce Dr. Keith Storey, and we can hear from her. And then at the end, we can have a chance to open it up to both speakers to ask your questions and hopefully have a bit of a discussion so we can really think about why sport and physical activity is so important as we think about kind of this community well-being piece. So what I'm going to do at this time is introduce Dr. Keith Storey. She is an associate professor in the School of Public Health at the University of Alberta and is a distinguished researcher with the Storey Children's Hospital Foundation. Kate is at the Center for Healthy Communities as the scientist and lead for Healthy Schools. Dr. Storey's research program focuses on school and community-based strategies to promote well-being, prevent chronic diseases, and reduce health inequities. Kate is also a mom to 2 young children who share her passion for adventure and being active. Kate was about to tackle a marathon that started at Everest Base Camp and work its way 42 kilometers down the mountain. And I guess I see a note here that it was not canceled, just postponed, so more adventure awaits. I love hearing all these exciting things that people had planned, and hopefully I appreciate that idea that it was just postponed, that you'll have an opportunity to do it at some point. So with that, I'd like to turn it over to Dr. Keith Storey, and we will hear from her.
Yeah, thanks, Jen. And yes, just postponed, and I hope the 2 small children that I have don't make their way into my office, but there is a chance. So I know that that's a very real thing for everyone here. Just going to share my screen here. Can you see that okay? Yeah, so Richard set this up quite well for me in talking about lots of what I'm going to touch upon, but what I'm going to focus on today is the community focus and the importance of community for overall well-being during COVID. So as Jen mentioned, most of my work is on school and community-based strategies to promote health and wellness. And so, you know, I'm going to be talking about that power of community and how the power of community along with sport and recreation can help support us through these times. So I also recognize that this picture is from the fall. And so I know we've just entered into nice weather of spring and summer, but this is a picture that a view that I get to see every day when I am going into the office. And so I think it's one of those things that we can look to as we look forward. And I'm very, I guess, pleased to say that this view now would be much busier because of COVID in many ways. So these trails are now packed. Before I begin, I just want to acknowledge I'm coming to you from my home, not at the University of Alberta, but I am in Edmonton, situated on Treaty 6 territory, traditional lands of First Nations and Métis people. So what has COVID done? I feel like COVID has impacted us all. As Richard said, we're maybe not all in this together, but we're all in this alone. But it has also created a time for us to kind of pause, reflect, and figure out what is and what is not working in many ways for ourselves, our teams, our families, our community. And I think that COVID in many ways has changed our city and trying to make us stronger together. So I'm an eternal optimist. And so when I see this, I think, you know, this isn't necessarily a tree in the middle of my bike lane, but it's an opportunity to pause, reflect, and climb the tree and get a new perspective. So I'm hoping that that will be our future moving forward. So why community within sport, within wellness, within health? Why should we think about community and its connection? So I think that COVID in many ways has really reminded us that we need to think of health more holistically. So I know that we often spend a lot of time talking about our physical health, but we also need to remember that we are whole people in whole communities, and that our health is very much holistic with a W, meaning we have our physical, emotional health, as well as our spiritual health. And that, you know, we're spending more time at home for sure. And so being at home can absolutely lead to feelings of isolation and lack of connectedness. And so feeling a sense of connectedness and belonging, we know, are extremely important, and can have an impact on our holistic health in more ways than one. And so we have to move beyond just focusing on our physical health, and the community very much influences our health. So if we look at this model, it really shows that we are individuals that have a network of people that also link in with organizations. And this is where in many ways our schools, our libraries, our other, you know, sports or recreation facilities lie, and then within community and policy. And I think as we look to this reactivation within Edmonton, I think we can really build on the strengths of our community and how to support our overall well-being. And this is a good reminder that we shouldn't exist in a bubble, even though we might feel like that right now. So the first thing I want to mention, and why this language is so important, is that language is powerful. And so as we start to look at reactivation, we need to ensure that we use the language of physical distancing, because we don't want to be socially distant. And so that shift in focus of language, I think, was an important turning point in how we're talking about COVID, and the importance of trying to remain socially connected, and that relationships certainly matter, you know, within our homes, schools, our facilities, and our communities. So with COVID, we know that there's been an absence of sport, there's been an absence of recreation, schools, and workplaces, and that is often how we define community. That is how we remain connected to one another. And without those happening, where are our hubs for social connectedness? And I think that we need to remember this moving forward, because these are often our hubs for social connectedness. So the teams that people were playing on, soccer, this is my son and his community league soccer last year at school. You know, we often aren't necessarily connected within our physical neighborhood. And I think that we need to remember this moving forward, that we need to think about, you know, sport and recreation as a hub, as well as schools and workplaces, but we can think beyond that. And this is where I think we can strengthen our communities to create healthier, stronger communities. So when I looked at how do we create a healthy community or a healthy city, which is something that I often like to do within our work, these are some things that we often think about, and ways that we can actually be connected socially, emotionally, and spiritually, while also promoting physical health. So first and foremost, get outside. And so I think that one of the positives in looking at what's happened since COVID is that there has been more focus on unstructured play. So yes, absolutely, I miss sport, I miss recreation, I miss going to, you know, connecting with friends and family with sport and recreation. But I also think that it's been an important lesson that some of that unstructured play is also really beneficial, and that time spent outside. So I took this picture a couple hours ago. This is just right outside my house. There are 2 trees in this park that are the climbing trees of the neighborhood, and the kids have been just climbing these trees constantly and running around this park. And so I think that that's been a huge benefit, and more people outside means more safety, often means more physical activity, again, physically distant, but also provides those informal opportunity for social connectedness. So we think of being outside often for walking or running or cycling or soccer, but being outside does foster that unstructured play, which then supports our sport and recreation community and our holistic health. That being said, Edmonton, we are privileged, I think, to live in Edmonton, and Edmonton has more than 160 kilometers of maintained multi-use trails, and really allows us to connect with our city's history and culture. So make use of the spaces, and the city of Edmonton has done a really good job at supporting, I think, Edmontonians in trying to maintain physical activity. So get to know these as, again, sport and recreation ramp up, it's that you can use these trails to remain connected, but also to get with active transportation from point A to point B. And Edmontonians are doing a phenomenal job at this. And so this was a professor at the University of Calgary that used Apple mobility data to look at, I think it was looking at April 26th, so amount of walking in April 26th, comparing that to the time that COVID-19 isolation started. And Edmonton was really leading the way at that bounce back of walking outside. So I think as a city, we really value this, and this is something that we can continue to promote. I mentioned active transportation. Oh. I mentioned active transportation, but this is another thing that I think that we've had a bit more of a focus on, is that we can really take this opportunity to learn about our city and promote active transportation. And borrowing from school zones, where we talk about the 2.4 kilometers in the school zone, you can really explore, and I know that EverActive Schools has been promoting this, but explore the 2.4 around your neighborhood. We know that people are more likely to engage in active transportation if they feel safe and confident. And so now is really the time to practice. There's less cars on the road and more people. And it's a really good opportunity to see what the Edmonton bike lanes, trails, and everything else has to offer. And here you can see that Edmonton has moved into using shared streets, so walking, cycling, driving, lane closures. And there have been some reports, albeit differing studies, showing that air quality may or may not have actually been improving. So these are all strategies that I think can connect us better as a city and connect us as a community. Another key component in terms of both community and social connectedness is our neighborhoods. And I think a lot of our neighborhood design in terms of having a healthy city or a healthy community don't naturally support social connectedness. But I feel like this desire to be more socially connected coming out of isolation is a time to form new habits. And so I think it's a reminder to get outside and move beyond the front door, to go for a walk and to connect with neighbors. And again, the more people outside, the more those opportunities are for the informal connectedness. These are just examples of things that have been happening that I think are really, really positive within the city. So wellness windows, I'm calling them, but there's a hashtag for YEG window art, as well as I know that there was a life-size sidewalk version of Monopoly that popped up. So again, these are things that we've been doing within school communities. I know, again, EverActive Schools has Don't Walk in the Hallway for schools. I would say that this is Don't Walk on the Sidewalk. So this encourages playfulness and movement, which of course we know physical activity can boost our holistic health. We've also seen pop-up community gardens within the city of Edmonton to support access to fresh food and ease worry of food security. But again, community gardens can also foster physical activity, intergenerational learning and connectedness, and is a way to be physically distant but yet connected. I have kind of two last points, and then I'll wrap it up in terms of how we can use the power of community to support our wellness and also build in physical activity, sport, and recreation. Is that we have evidence time and time again that role modeling healthy behaviors or behaviors in general, kids are more likely to follow in the footsteps of others. And so if the families, you know, for better or for worse, we're spending more time together as families, you know, sometimes your children might be on Zoom with you, but oftentimes they're out playing with you. So getting outside with your children, being physically active with your children is a really good way to connect with them, to allow them and yourself to have time outside, which boosts mental health, but also to allow you to be physically active. And last, I think on the focus of children and youth is that we really need to look at the power of youth in our community. And as I know Richard talked about, people are feeling bored and not having things to do and looking for things to look forward to. You know, there's a lot of examples of youth being drivers of change in their community and really being those that are tremendous role models and can spark these changes. And so this is an example of a Calgary led initiative. Jamie works for ReActivating, the Joy for All project, which allowed youth or lots of people to provide jokes so that seniors in the community could call in for jokes and spread joy and love. Edmonton does have a toolkit for daily life during COVID-19, which has a lot of in terms of staying safe, connecting and supporting with your community, being active, and other things that you can do. So that's, I think, a really good place to look for information. And I think just the last thing is that I think we may find that we may feel like we're climbing this mountain alone as we move through these unprecedented times. But you know, I do believe that we are stronger as a community, and if we can learn some of these community lessons as we continue on, it will just make our city even healthier and even stronger. And also that kindness helps too, and love helps too. And so, you know, while we might not be able to necessarily always hug and connect, I appreciate the power of that. We can send love and connectedness. So this is something that my son drew for today. That is it, and I'll end sharing my slides, and I know that then we have lots of time for questions.
Thank you so much, Kate. We really appreciate your thoughtful comments today. It starts to make me feel hopeful having these conversations at this point, kind of as we are looking to kind of relaunch or reactivate our city and our community. We have a few minutes, a little bit of time for questions. So for folks who are out there who have heard the words from both Richard and Kate, if you have questions for both of them, or you would like to make a comment, you're welcome to put that in the chat. Or, you know, if you want to turn off your mic, turn on your mic, we can certainly call on you, and you're welcome to ask the question in person. While we give folks a chance to type in their questions, I do have a question for both of you. I'm thinking about kind of myself as the director of an organization. We support folks with disabilities coming in and being physically active. And we know that many of them have been quite isolated during this time. And so I was just curious if you had any advice for ways that we can encourage folks to reignite those social connections while still maintaining all these other guidelines that we have in place. Like, you know, it's important that people are still physically distant, and I know that our space is going to feel very strange when we come back to it, because they're used to being so friendly and warm, and suddenly you have staff wearing masks, and it's going to be a different environment. So I'm curious if you have any suggestions about how us as an organization can foster social connections as we start to reopen.
Well, I can take a crack at it. That's an excellent question, particularly in your setting. But I think one of the things that has, at least I've observed, and I think others are observing, is that we're sort of coming out of this kinder and gentler. And it's a little bit like the great philosopher Joni Mitchell, you don't know what you got till it's gone. You know, we never realized the importance of our social connections and just human interactions, of being friendly, being nice to each other, of being kind, until all of a sudden we didn't have that opportunity. And so I think being a little bit slower, a little bit more personal when we can, and it benefits everybody. Real cool thing is if you do 5 acts of kindness in a week, it benefits your health for 3 months afterwards, believe it or not. And all of the research shows that when you're kind and nice to others, you actually get more benefit than the person that receives the kindness. Not that they don't. So it's one of these really neat things where it's just sort of, it's positive reinforcement, just builds on itself. So I think that's one of the things is to take the time to talk and look at each other as, as whole people.
I would absolutely echo that. And I think another point is just to keep reminding ourselves that sometimes those that are most vulnerable and isolated as the world reopens will become even more potentially vulnerable and isolated. So meaning that, I think of my in-laws who are in their 70s, and I think about, they've had this period of some connectedness, but how are they going to feel as, potentially numbers spike? And so does that force those that have worries into being, you know, we look to Sweden to what happened, right? So I think that it's just a continuous conversation and a reminder that we can't, that we need to remember that this is still very real at the same time as having that optimism, that hope, and that connection, and that also recognize that balance of people need to be connected for their health, you know, even given some of the risks of being connected. So yeah.
Thank you both for your responses. That really actually helps us a lot and gives me some good things to think about. Brian, I noticed that you had a question. Would you like to ask that yourself?
Yeah, just maybe it's so thank you both for the presentations. I've asked this a few times, is that we are seeing on the positive side, there are some positives that are coming out of in terms of our behavior. I think more people are on bikes. I think we value and appreciate our green space a little bit differently. So maybe just in your opinion, what positive health behavior may come out of as we come out and recover from COVID? What's a positive health behavior that could stick with us?
I guess we'll go to, you know, I think what I noted before is that, you know, people are interacting a lot more than what we used to do. And all you could do is go out for a walk. You'd start to run into your neighbors and you would chat. And of course, whenever there's a crisis, you know, when there's a fire and everybody's gathered around, you know, the fire engine, people talk to each other, or when two people, dogs meet each other, they'll talk to each other. But, you know, go and talk to a stranger without a reason often seems strange. But I think we're probably starting to again redevelop some of those social connections. I think the other thing is that we've seen everybody out, as you pointed out, on, you know, out on bikes, out walking. You know, I saw we're the #1 city for walking, and I think probably that's reintroduced people just to the joy and the benefits of being outside, and particularly when we don't really have a nice outside for 6 or 7 or 8 months of the year. When it's so nice now, I think that's really going to help us with developing some of those habits of just being outside and enjoying the green spaces and nature, as Kate said, and as research tells us.
Yeah, I would say the connections within the physical space of your actual home. So I think, as you know, we look at how community is defined. I think it's great that community is defined a variety of ways, you know, and how people are connected. But with open school boundaries, with all sorts of, you know, busy schedules with sports teams, I feel like people were not as connected to their physical space in which they dwell. And so that exploring the space around your neighborhood and getting to know that there's a little pocket of green space. And to be honest, I love the unstructured play that, you know, I think for a lot of people, closing playgrounds was, you know, devastating, but it also forced us to look at how we play and move within our spaces, and be less reliant on some of the, you know, more structured elements. And so, you know, the free range children, I think, has come out a little bit, but I think also for adults that informal connections, and the fact that, you know, neighborhoods haven't necessarily been designed always to promote those connections, where there's not a porch that, you know, the driveway is there, or even where apartments and condos are placed. And so I think maybe we'll think a little bit more about how we would want to live in our spaces. I know that's not a health behavior, but fully.
I've heard the term hyperlocal. Like we're going to come out of this a little bit more hyperlocal, and I think of how that is going to change how sports is being delivered, because quite often within our sports system, you know, the after school time period is a lot of running around, and it's not always within our community. So I think how it impacts sports, we might see a little bit more element or desire to be more local with our sports. Thank you both.
I would say selfishly too, as someone that cycles everywhere or runs, I've been happy to have more space, and I am pleased to see people that, you know, haven't always, all the people that have been taking up cycling or learning. I think it's a really great thing for our city. There's now more bikes around. So I think that that's, can only benefit. We just need to get people continuing throughout the winter.
Excellent. So we've got a question that has come to us in the chat box. So I'm just going to read it out for you both. So it says, This comes from Mark. We all agree on the importance of social connections and the role that sport and recreation can play in fostering belonging. But there is a problem in sport and recreation that Mark says he's recently heard it coined as systemic elimination. So essentially looking at the system as being designed to weed out individuals through privilege, competition, development, and basically like an exclusive elitism. So COVID is amplifying this, especially in the reopening. How do we not only mitigate this, but create a focused change to the system so that we can be more inclusive for all? So kind of to follow up with that, you know, thinking about it in terms of resources that are going to be tighter, facilities are going to be hard pressed to book spaces for revenue, and it eventually comes down to those with and without. So I wonder if either of you have any comments around creating that kind of change to the system in a way that is more inclusive for everyone within the community.
Oh, wow. It's a big one. I mean, I think that this is where I said, you know, as the world reopens, those more vulnerable and isolated become more so, right? So this is a very good example of that, of the system, you know, weeding out individuals. So I think the first step is being aware of it, and, you know, the fact that it's named and there's language around it can create conversation and dialogue. I'd really, you know, how do we think about this? And there's a lot of challenges out there. I think, yeah, I would have to pause and think about it, but that's my first thought, is that this is a good start. I don't know, Richard, if you have anything else to add.
Yeah, it's a really complicated area, and I absolutely get the point. Is that, you know, we push our children or people that you've got to be on the, you know, on the podium, you know, winning the gold medal at the Olympics, and you've got to be, you know, part of the professional, you know, sports team, whatever that might be. And so yes, so people stop, you know, the children start dropping by the wayside as we have this focus on that, you know, achievement and success and best of the best, and really have to be really aware of, you know, a lot of this is fun, you know, that we want to do this for the fun, for those purposes. And I think, you know, there is research that particularly as you start getting into those higher levels, into the teen years, you know, the drop off, particularly amongst girls, is quite high because of this push towards, you know, being the best in the challenge. And then of course we lose all of the benefits, not just the physical benefits we think of, but, you know, the mental health, being part of just a group of just having fun. So whatever, you know, I don't have the magic answer, but whatever we can do to promote that would certainly be helpful. You know, on the other hand, they do point out that children do pay attention and are motivated by, you know, the Olympic athlete, you know, that wins the 5 gold medals swimming, and so on, and gets people involved. So I'm not the expert here, but, you know, somewhat of a balance.
So following up there, Mark added an additional comment. So thinking about, when do we focus on playing just to play? So maybe that goes back to kind of the unstructured play that Kate was speaking about, or Brian's comment about the like hyper-local kind of sport groups that are really focusing maybe more on this aspect of play rather than on competition. So if there's any comments around, you know, developing systems and programs focusing on play and being active rather than competition, because playing just to play is really the largest part of our society. So I think that comment really builds kind of on some of the themes that have been coming out today around this idea of maintaining our focus and emphasis on unstructured play and kind of where that fits.
Yeah, I mean, I think this is one of those things where we've created this system and this culture, right, that we are almost trapped in. And I've heard comments from friends of ours that have older kids, you know, saying, we're really thinking this has been a bit of a reset and thinking, do we really want to be driving everywhere? I often, I have a bit of work that I do around promoting healthy sleep habits amongst kids. And I always say the first step is to engage in healthy sleep talk. So if we're always saying, oh, I only slept 3 hours, and that's, you know, I call it, instead of, you know, it's like a sleep one-upmanship. It's like, oh, I, you know, practiced for this many hours, I had to drive this many places. I think those of us that are supporting the system need to start trying to think about if we like that dialogue, you know, or if we want to have the dialogue around unstructured play and play. because it's pretty hard to just say, no, we're not going to engage in, you know, if coach says you need to have 5 days a week, we're going to only do 3 because we want to have unstructured play. So it really is a shift in culture. And I think that, that we have to lead as, you know, both the kids as well as adults in having these conversations. Do I think it's going to happen tomorrow? I don't know. I mean, I'd be hopeful, but I feel like we may just go right back to where we were at. So, but I think this is a conversation. I think lots of people are having this conversation that have kids that are in sport. My kids are just 4 and just 7, so I'm not quite there yet, but I can appreciate that it does get busy.
I was also going to add the importance of the unstructured play. The importance of just plain old ordinary play is important at all ages, but particularly in children. It really, what they're doing is they're not just playing, but they're learning relationships, social interactions, conflict resolution, all of those sort of life skills. I mean, I'm very biased. You know, I'm a university professor and I'll probably don't use 95% of what I learned in school. Yeah. So maybe we should spend more time, but you sure learn about relationships, getting along with people, all of those sorts of things.
I thought there was an interesting comment here from Joel, and he says, kind of building on this discussion around knowing that we all value sport and rec and the positive health benefits, it's kind of interesting because as professionals working in this industry, it almost feels like we're a special interest group, and that we need to continually justify why we exist, and that, you know, some folks feel guilty for asking for government support, funding, etc., when we all want 3 things: time, money, and space in order to provide these services. And the post-COVID outlook feels like we are going to be the first area to be cut. So I think that's a really, you know, interesting point, that we all sort of have this shared understanding and appreciation that sport, physical activity, and recreation underpins everything we do and the health and well-being of our communities. And yet it often does feel like we're kind of a frill. So how do we kind of make it a priority so it does get boosted in terms of priority in the eyes of the government and the municipalities, so that we don't have to feel guilty or don't have to always justify why we're important? Similar to like education and healthcare, we don't have to justify why they're important. So I think this is an interesting comment.
Well, one could get somewhat philosophical, this sort of like right up my alley in terms of it. It turns out that our health and what leads to health is all of these things is you know, the sport and the recreation, not just the physical, that people think that, you know, you're going to control your weight or have that physical benefit. But as we heard, you know, the mental, the emotional, the social, the community benefits that occur as a result of that, arts as well, all of these things that we think of as luxuries, turns out paradoxically are probably the most important. And the way I like to frame it is, you know, if I could give you a magic pill that gives you perfect health, you wouldn't be sick a day in your life, never develop heart disease, cancer, none of that. Would you take the pill? Of course, everybody goes, sure, of course, I'd love that pill. I said, but of course, there's a catch to it. With that pill, you'll have perfect health, but you have to live homeless, cold, hungry, with no friends, on the street for the rest of your life. Would you do that? But you'll have perfect health. And that really underscores the importance of wellness. When you see the Blue Cross commercials about wellness, that's what they're referring to, is not just, you know, health does not equal wellness. You know, wellness incorporates all of those other things that are really important to us.
There's a couple of other comments. Adriana shared one saying that being aware of systemic elimination, like we spoke about before, is a great first step, and suggesting that the next thing we can do is, when we find an organization that's really supporting unstructured play, especially for those working with marginalized communities, we really need to amplify them and share their missions. So that's another good way to kind of, I guess, highlight the good work that's being done in our community. And Brian offered that we need to get the narrative correct. Social service, health and well-being, social connections, belongingness. These are all important in our messaging as we are looking at resetting sport. So being aware of the time, we just have a couple of minutes left. I wanted to kind of put it out there to see Kate and Richard, if either of you have any closing comments that you would like to kind of offer today. I realize it's been a very fulsome discussion, so I don't really know how you wrap it up with a quick summary, but I wanted to give you an opportunity to kind of share any last thoughts with us.
Well, I think everybody here appreciates and hopefully understands really the importance more than just physical of recreation, activity, sport at all ages. Just a very quick advertisement. Thursday night, the City of Edmonton is actually sponsoring the documentary, The Great Disconnect, which addresses the impact of social isolation and loneliness on communities and our need to be aware of it and to address it. So, so just a heads up on that.
I can't really do better than that. I mean, appreciate the time, and I think, yeah, I think as we move forward, I think remembering some of these lessons and to continue to lead with kindness, I think is, you know, hopefully, you know, and remembering how much of a focus sport and recreation is in our lives, and I think we're seeing that time and time again, and that it is bigger, and it is that piece of connectedness, of socialization, and really links to our holistic health. So.
Absolutely. Before I say my final thank you, I do want to let you know that Gary has put information in the chat box for everyone. So the ReActivating Edmonton webinar next week is focused on COVID-19 and waivers. So that will be on Tuesday, June 23rd from 3 to 4 p.m. So the same time. And this will be a discussion with Vivian R. Stevenson, who's a lawyer, and really focusing on sort of, as we think about return to play, focusing on waivers, assumption of risk, and what that all means, so that as organizations are thinking about the return to play, that they can do so safely and kind of knowing what risks are involved and how to mitigate those. So there will be information sent out, but just kind of a heads up that is coming. And I would just love to say a huge thank you to Richard and Kate today for your time. I definitely learned a lot, and I really appreciate all of your thoughts and research and wonderful things that you shared today. And for those of you who attended today and who shared your thoughts and ideas and questions in the chat, we really appreciate that as well. It really makes for a really interesting discussion. So at that point, I think we'll say a goodbye and a thank you. And knowing that it is a beautiful day, I think everyone's hopefully motivated to go and enjoy the many, many hours of daylight that are remaining in our day today. So thank you very much, everyone, and take care.
Thanks,
Thank
everyone.
you.